Hey everyone, it's Charlotte Fairburn, owner at Aesthetics 360 Face and Body Center in Milwaukee's historic 3rd Ward. So last month I talked about what is a medical spa, what to expect when you go to a Medi-Spa for the first time, and what type of concerns are treated at a medical spa. So today I'm going to talk about questions to ask. What should you look for when you're going to a medical spa? Whether you already go to one or you're going to someone for the first time, you need to ask a lot of questions. Please do your homework. Experience, credentials, results and outcomes, comfort level, and you might be thinking, well, and also what about price? So we'll talk about that as well. Please don't base your decision on pricing. There are so many people getting into this industry because it's really booming, and it's an exciting industry, and the treatments that are offered, they really do work. They can really help people create a new opinion of themselves, inspire confidence, and really give you a new way to feel. But with that comes buyer beware. There can be unqualified or less than qualified people entering the market. You have businesses that don't specialize in medical aesthetics offering Botox treatments on the side, for example, or a couple days a week they have somebody who comes in and does treatments. So ask a lot of questions. Not how long have they been a nurse, but how long have they been injecting? What type of training have they had in terms of advanced and master level training? And that's what you want to look for, because there's so much to know when it comes to the face and the anatomy, the vessels, the nerves, the fat pads, the muscles, how we age, how everything synchronizes together. When you inject one area, is it harmonious to the rest of the face? We have to look at everything as a whole, and it takes a lot of training and experience, and really knowing how to handle complications. There's a saying in medicine that if you haven't seen a complication, that means you haven't done enough treatments. So how are those handled? The only way to know that is with the experience. So looking at that, looking at the results then, looking at their own before and after photos, and of course your own results. Have you been happy with your results? And there are a lot of great providers in the Milwaukee area, but there are some that are not as qualified as others. So ask a lot of questions. And then, how are you feeling? How is your experience? Your experience starts from the second you contact, whether it's via text or an email or a phone call, to when you walk in the door, to your interactions with everybody on the team, and to your post-care and your follow-up, and even the photos that are being taken, and are the results being proven to you with a chronological sequence of photos every time you come in, and really proving those results whenever you're seeing your clinician. And then, well, there's price. So price should not be the factor that you look at. Now everybody in town is kind of in the same ballpark when it comes to pricing. Maybe within a few dollars, $50 at most. I've been in this business for 20 years and have worked with practically every practice in the state, and everyone is kind of in the same ballpark. The average price for Botox is between $12 and $14 a unit. The average price for a syringe of Juvederm is going to be between $550 and $600. Of course, there are lots of times when specials are being offered, and other discounts and other loyalty rewards, and ways that you can save money on your treatments. But when it comes to your face or your body and spending money that you could spend anywhere, because this is not insurance reimbursed, you really need to do your homework, because we only have one face, one body, and sometimes only that one opportunity to really be in the right hands when it comes to your medical aesthetic treatments. So again, do your due diligence, ask a lot of questions, and then you can't go wrong. So to be honest, I don't know what I'm going to talk about next month. So leave a comment if you have any questions that you'd like to know answers to, or any treatments or concerns about the industry that you'd like addressed, or myth versus fact, or anything like that. And we'll take a look at that, and then we can address it in a future segment. So thanks for tuning in.